Okay, hi everyone. So today's a little top tip Wednesday. I'm just going to briefly talk about isometric contractions or isometric exercises and how they can be beneficial to your rehab and just sort of general training principles. So isometric means same length. Okay, so it's a static contraction where the muscle fibers have no movement at a joint, so they don't shorten and they don't lengthen. Okay, it's good for static strength training, okay, and also as a introductory rehab exercise to improve range of movement, etc., when there may be too much pain or discomfort, etc. So they're good as a nice introductory exercise. Okay, so the many benefits of these type of exercise, like I just mentioned, is that they're low impact, therefore they're safe. You don't need any equipment, and they help improve strength, range of movement, and add a little bit of variability to your training, and they obviously can help decrease the pain that you'll experience. Okay. As a similar technique is used in the treatment room by a therapist called an MET, which is a muscular energy technique, which basically utilizes that isometric contraction, where your therapist will bring your body into a position and ask you to contract at about 20% of your maximal force against their arm, etc., in that static position. So you may have had some treatment like that before. It's not the PNF stretching. PNF is a different kind of stretch where you exert a maximal contraction, although it is still technically isometric. The aim is difference between an MET and a PNF. Okay, example exercises of which is isometric, things like the plank, side plank, your kind of prayer pose in yoga, okay, a wall squat and a wall press, things like that are all classed as isometric contractions. When performing these exercises, it's remembering to really kind of squeeze when that position you're kind of pressing against the force of the other hand there, okay, and to make sure you breathe. Don't hold your breath, okay, because that's then not inducive to the good muscle contraction, etc. And kind of hold for about 20 to 30 seconds at about 20% of your maximal contraction. Isometric contractions can be formed at any joint. So if you want to hit a specific joint, so say for example you want to isometrically contract the bicep, okay, you would simply resist trying to do a bicep curl, but you could use your other hand to resist that movement, okay. And then conversely, even say for the wrist, if you're trying to bring your wrist upwards, you can contract against it there with the other hand, okay. So they can literally be utilized across any joint in the body. Give them a try. If you're suffering at any particular place, you can use your another part of your body to do the resistance, say, or a piece of furniture or a wall. All pretty safe to do. Give them a try and let me know how you get on.